And here he is with his converted denture for his follow-up heel check. So to be able to take a patient who was unable to wear their denture to someone who has fixated teeth on the day of surgery, I think this is within the capacity of most surgically oriented general practitioners if we can separate out a lot of the phases. Hello everyone, welcome to Full Arch Implant Placement in the Heel Ridge. I'm Dr. Patel, I'll be your moderator and speaker for this CE video. This is an excellent topic for the budding implantologist, maybe someone who has delved into implantology, has done lots of singles, maybe multiples, maybe have done some overdentures, and is looking for, a pathway to say, how do I get involved in this? Patients are asking me for this kind of, teeth in a day, or whatever we want to call it, teeth that I don't have to take out and put into a glass at night, something more secure, more fixed than snap in or snap out denture. And I think that rightfully so, because as technology evolves, it does a lot of things, and one is it makes surgery a little bit more predictable. And as technology and manufacturing evolves, it certainly drives down costs. So we now have implants that I consider to be premium products at value price points. There are some suggestions maybe that for your surgery if you're starting on this journey for the first time. And one of them is that if you're going to be talking about taking out teeth and using implants for immediate fixation of a temporary bridge or a converted denture, you have to pick an implant that's an aggressively threaded implant. And this happens to be the Hahn implant. And I would say an implant like this is a good choice because it's going to get you that primary stability that you're looking for as an implantologist who wants to place an implant into an extraction site. And that's paramount because if we're talking about converting the patient's denture on the day of surgery, we have to have that good primary stability. So we don't want to use an implant that doesn't allow that kind of stability to happen. The other suggestion I really would have for you is I want you to embrace the concept of this multi-unit. And there's a ton of reasons why we want you to embrace the concept of the multi-unit. But first and foremost, I like it because it brings everything to tissue height. So prosthetically, everything is going to be done at the tissue level at this point. So can we do this? Absolutely. If we'd taken out this patient's teeth, leveled the bone, grafted, made sure that his transition line is above where he can lift his lip, then why not be able to take that patient and then put our implants in, and if we need to do a tilted approach to stay in front of these pneumatized sinuses, we can then place a long implant, stay in front of that sinus, and do that on both sides. Embrace the use of a multi-unit, and these happen to be 17-degree multi-units because the slope of the maxilla has resorbed like this, so I want to bring everything back to where the prosthetic channel is behind the incisal edges of the anterior teeth. And then we can take his denture and we can convert it. We can convert his denture into something that we are going to turn into a screw-retained prosthesis for him to wear the day of surgery. So we get that converted, which means that we took away everything that we needed to take away and only left what we needed to for him to have the support he needs and made the underside as smooth as possible so it's cleansable. And then he goes home with a converted denture with no cantilevers at this point because the implants have just been placed. But now the guy has what we call show teeth. He can show people he has teeth. But we let him use this, that has fixated the implants together, gives them the ability to have the confidence of teeth that are screwed to his implants that are not going to fall out while he's healing. If you extract teeth and graft, which I think most of us could, I think you can probably come to the point of this and say, if I can embrace the use of tilted implants, if I need to get around a sinus, then I think we can have the success that you're looking for in full arch implant dentistry.
Are you enjoying this instructional video? I hope so. If you'd like to receive additional clinical instruction with AGD and ADA approved CE credits, all at no charge, be sure to visit glidewelldental.com/education, where in addition to over 60 on-demand clinical courses, you can also access our weekly webinars along with other valuable content.